people do not trust that their care will be handled sensitively, that they alternatively will choose to not come at all. You're going to hear from people today who have seen the immense, unnecessary suffering when the dignity of our sensitive spaces is breached. These are phenomenal healthcare workers that show up every day to serve as a vessel for healing and a helping hand for humanity. They know that our work starts by seeing oneself as part of something larger, as part of a community, an ecosystem, and a beautiful web of love and healing. I'm going to start with a poem written by Luis Valdez that our committee uses to ground ourselves in this central aspect of our work. It's called En la Quec. Tú eres mi otro yo. Si te hago daño a ti, me hago daño a mí mismo. Si te amo y respeto, me amo y respeto yo. You are my other me. If I do harm to you, I do harm to myself. If I love and respect you, I love and respect myself. Thanks everyone for coming. We'll start with our first speaker.
My name is Jill LeBrun. I am a registered nurse at Fairview Riverside West Bank and a board member at the Minnesota Nurses Association. For weeks, Immigration and Customs Enforcement, ICE, has been present in or around hospitals in the Twin Cities. That presence undermines trust, discourages people from seeking needed care, and interferes with healthcare workers' ability to provide safe, effective treatment. Every patient deserves to feel safe in our hospitals, regardless of their immigration status. That is true everywhere. It must be true at Fairview. I stand here today with union and non-union represented healthcare workers and community allies, including Unidos, MIROC, and SEIU. We know how important organizing work is, especially at a moment like this. We are proud of the work that started at Hennepin County Medical Center and continues at hospitals across the state. Because we have seen what happens when immigration enforcement tactics enter healthcare spaces. When ICE is present in or around hospitals, when patients are questioned or detained, when people see others placed in custody, that creates fear. It means people delay care, they avoid hospitals, they suffer in silence. Trust is essential for safe care. When trust erodes, patient safety erodes with it. And when nurses speak up, change happens. Now we're calling on Fairview to act. Fairview must implement clear, effective policies for immigration enforcement in healthcare settings. Healthcare workers are demanding clear policies, not vague assurances. Anything less puts everybody at risk. We are calling on Fairview to adopt a model policy for immigration enforcement in healthcare settings, a policy built by immigration networks and healthcare unions working together. That policy includes clear protections for patients and staff, resources for immigration-related training, and recognition of healthcare workers as experts in protecting safe patient care when it is at risk. Let's be clear. ICE must not be permitted in private hospital or clinical areas without a signed judicial warrant.
That's right. Yeah.
Anything less jeopardizes patient privacy and violates laws, including HIPAA. Patients detained by ICE are under administrative custody. They are not criminals. There is no justification for shackling a patient to a hospital bed because of immigration status. applying criminal detention measures to people who are not charged with crimes is cruel and unjust. It is time for Fairview to step up. The announcement that Operation Metro Surge is ending does not erase the fear patients are living with. It does not undo the harm. It does not restore the trust. That is why we stand here to demand that Fairview work with us and adopt a model policy that protects patients and protects healthcare workers. Our patients deserve safety, our communities deserve trust, and our hospitals must be places of care, not fear. Thank you.
Hello, everyone. My name is Dr. Caitlin McLean. I am a resident physician that works in this and several other hospitals in the Twin City metro area. I am proud to be a leader also for CIR Minnesota, which is the resident and fellow physician union now here at the University of Minnesota. We are here as your doctors because we took an oath. Our job, first and foremost, is the care and safety of our patients, all of our patients. On every floor of this hospital and in every specialty, there are resident doctors ready and willing to care for you regardless of who you are.
That's right.
Unfortunately, as we all know, over the last several weeks, our communities have been impacted in ways I truly never could have imagined. I've heard from colleagues about families with newborns too afraid to do their very first well baby check. I've heard about kids with infections that waited until the illness was so severe they required an ICU stay for something that could have been treated in a primary care clinic. I personally know of patients and have patients that have been unable to get medications for chronic diseases like high blood pressure and diabetes. There are impacts on health that we may never be able to truly quantify that will impact this community for years to come. The examples of this could go on and on. We know that federal immigration officials have been in these hospitals. It's beyond important that we have guidelines and policies that protect our staff, our physicians, our nurses, while we do the work to care for these patients. Okay? Our number one priority will always be and has always been the safety and well-being of our patients. It is the hospital's job to allow us to do that safely. We need to know that the hospital has our back while we do that important work. To everyone watching from home, I wish that I could tell you with absolute certainty that it is safe for you to leave your homes and come to the hospital. I don't feel comfortable saying that to you. But what I do feel comfortable saying is that these people here will do everything possible to take care of you if you need help. We want you to get the care you need. I know that this time is scary in ways that I cannot fathom. And I know that there are people out there who have been delaying care, and we are here for you. And we are here asking the hospitals, and this hospital in specific, to support us in caring for you. And I want you to know that these people, this coalition of union and non-union healthcare workers and community leaders and representatives are here to help. If you have a chronic condition, if you have a child, if you have an acute need, call someone, come to this facility, know that you can trust in us because we are here for you. If you feel concerned about a medical condition, seek care. Fairview, allow us to keep that promise to our patients. Keep private areas safe. Keep private information private. Care for your staff members the way that you have promised to do so in the past. We will do everything in our power to care for you and keep you safe. We will not stop fighting for you, no matter the pressures we face. Thank you.
Here like this instead of at this angle, more like this angle. Thanks.
Can we turn this way so people can hear?
It's like we spilled tea, guys.
Spilling the tea.
Flexing moment. Are you good?
Yeah.
Do you want like a thing to dry off? Okay.
I'm just gonna test this real quick. It really has to be like really close to your face for it to work. But I'll hold it. I'll do my best. If you can get like kind of close to your face.
My name is Kirby. I'm a proud SEIU member and healthcare worker at Fairview's Riverside Hospital. Today, I represent hundreds of Fairview workers demanding our employer reclaim our hospitals as sensitive spaces where patient care and worker safety are not disrupted by ICE activity. Fairview claims its vision is to be the most human-centered healthcare system where all communities they serve benefit from their services. But I'm here to tell you, Fairview's administration is not living up to that vision. For months, ICE agents have engaged in deeply troubling incidences, raising serious safety, privacy, and ethical concerns at Fairview work sites. ICE agents covered up hospital security cameras in the ER, violated our patients' right to privacy, verbally and physically intimidated workers, racially profiled and interrogated workers of color, stalked workers to their homes and harassed their families in their personal lives, shackled patients, detained a worker, persuaded some staff to disregard their nursing discretion, and traumatized our patient population. We're starting to see in our hospitals that a patient's presenting problem is trauma, interaction with ICE. And don't forget, when ICE agents abduct residents, those were our patients and our workers' friends and families they kidnapped. When ICE agents tear gas, assault, and murder residents, they do so in our patients' and workers' neighborhoods. Despite these incidences triggering a need for new and improved procedures, Fairview hasn't offered us workers any updated policies in the past few weeks. So us workers stepped up. First, we started in our communities. For months, us workers have carpooled with our immigrant coworkers and walked them to and from work, attended legal trainings to confidently practice patient care in ICE presence, joined neighborhood and school patrols, rapidly responded to ICE abductions, administered mutual aid networks, organized, attended, and marshaled protests and rallies. And where was Fairview? Oh, right. They released a public statement calling for calm. And when that statement did nothing for our patients or colleagues, us workers do what we do best. We organized. For months, us workers organized 100+ employees from several Fairview hospitals and clinics, sharing insights to how we could improve patient care conditions, identified specific changes to training, policies, patient care, and job protections our employers could utilize, voiced our concerns with supervisors when we felt they discouraged discussions about ICE, and committed hours and hours of unpaid labor to doing the right thing, living up to the vision of human-centered healthcare that Fairview preaches so much about. Us workers want to say to our patients, we're here for you. We will fight with you every day to make sure you get the care you deserve and need. And we will hold our colleagues accountable who attempt to give you anything less. To Fairview's leaders who initially drove conversations around policy change, thank you for your efforts. But leaders must recognize there are still widespread equity issues at Fairview related to the ICE occupation. This has a negative impact on Fairview's patient care delivery system. And now to Fairview's executive leadership. Our patients, our workers, and our twin cities deserve policies that match the realities we are facing. Join us in implementing these best practices so we can provide equitable, safe care to our patients they can trust.
Good afternoon, everyone. My name is Austin. I'm a local healthcare worker and volunteer with the Unidos Minnesota Healthcare Justice Committee. We hold trainings where hospital and clinic employees come during their free time to learn how to approach ICE, how to deal with ICE in the hospital, and how to navigate these dire situations. Since March of 2025, we have trained over 1,000 healthcare workers in the Twin Cities Metro with how to deal with ICE in hospitals. With feedback implemented from attendees, stories from local cases, and collaboration with experts in other states, we've refined what it means for a hospital to be a sensitive space. In the last 8 weeks, we've seen ICE bring patients from detention facilities to hospitals for care of chronic medical conditions and injuries sustained during arrests. In these scenarios, hospital employees have witnessed numerous human rights violations, and tragically, frontline workers have been disrespected, harassed, and threatened by federal agents while trying to protect the rights of their patients. The hard truth of our reality in Minneapolis is that people in ICE detention still need health care, and because of that, we still need ICE to bring those people to the hospital. So it is on the hospitals to be ready for these situations, and they can be by proactively implementing clear, just policies. Downtown, our community safety net hospital has already adopted practices and workflows that we are asking Fairview to implement. In North Minneapolis, workers at North Memorial Hospital are already organized and prepping to do the same thing. These asks are possible. The Unidos Minnesota Healthcare Justice Committee stands here today with our labor partners at M&A, SEIU, and CIR, as well as our community members, our elected officials, and fellow immigrant rights organizations to demand common sense policy change at mHealth Fairview. Our complete list of best practices has been distributed to members of the press and is available through Unidos Minnesota. The following, however, is a summary of some of the guiding principles of our work. 1. Hospitals must establish a policy that differentiates patient care for patients in criminal custody versus those in civil detention. Contrary to criminal custody, we know that patients in DHS civil detention retain most of the rights enjoyed by everyday people. That includes the right to privacy, the right to use a hospital phone to contact legal aid and family, and the right to receive health care without being shackled to a bed. 2. Hospital policy must protect staff members. At-risk employees must be allowed to change their assignments if DHS's presence makes them unsafe. Employees need a workflow for reporting federal agent atrocities to political power holders without fear of retaliation from their employer. Policy should allow for the care team to conditionally discharge patients to DHS facilities, to prevent them from being discharged to a place that can't care for their wounds, that can't give them their medications, that can't treat their chronic healthcare conditions. Simply put, we are preventing unsafe discharges of patients to ICE detention. And finally, hospitals must provide community members notice of internal DHS activity at their facilities. Hospital leaders repeatedly say that notifying staff and patients of ICE's presence only generates fear. We hold strong in our belief at Unidos Minnesota that it is ICE that generates fear, not bedside workers who are asking for transparency.
Here, here.
Patients and staff need to have the facts when assessing their risk while seeking care and while going to work. In closing, Unidos Minnesota and our partnering organizations are calling on Fairview to implement a policy guided by these principles that protects the rights of patients in civil detention and the caregivers. But to be clear, Fairview is not alone. This is just the beginning of a statewide campaign to ensure that everyone can safely and confidently access care. We plan to bring our community back to care through earned trust and solidarity. The obvious first step is for hospitals like Fairview to lay the groundwork with comprehensive, firm policy that keeps patients safe. We must protect the sanctity of the help and the healing that goes on in the walls of these hospitals. Thank you.
Hello everyone, I'm Representative Anna Mahmoud and I represent 62B, a part of Southside. So ICE has created a public health crisis and it's up to us as a state and community to fix it. As we have heard from our frontline workers, emergency department, pediatrics, primary care, and OBGYN clinics have been empty. People who are suffering, people who are in pain, people who are sick, are deferring care because they do not trust that they will be safe from immigration enforcement. This includes children passing up necessary wellness visits. This includes pregnant people missing life-saving appointments, laboring at home, and waiting until the last possible second to come to the hospital. Our community does not trust the laws to protect them. Our community does not trust that the hospital system will protect them. As we see today, there are many frontline workers here. Nurses, doctors, and techs who will protect our community when they seek care. They have stepped up to protect us during Operation Metro Surge and will continue to do so moving forward at their own risk. I speak directly to my constituents. Please trust us. Come in for your care. Come in for help. We have frontline workers who are willing to have your back, and they do have your back. Now is the time for the state of Minnesota and our hospital systems to step up to have the back of our frontline workers. Corporations like mHealth Fairview, the third largest employer in Minnesota, must listen and trust the workers as they organize to protect our community. The state of Minnesota must listen as well. This is why I am honored and excited to announce the Healthcare Dignity Act that we are bringing to the Minnesota legislature. This bill will ensure that hospitals remain safe, sensitive spaces that Minnesotans can trust. While we're still working out the details of the bill, the goal generally is to make it necessary for law enforcement to have a judicial warrant to make in order to perform a search or arrest within the hospital space. Hospitals should not be a place where anybody should be worried about their immigration status, their race, or their ethnicity. Hospitals should be a place where the most vulnerable can come in when they are the sickest, the most vulnerable, and when they need help. This is a place where you could come and not be judged based on your presentation or prosecuted. It is all of our work as a community and frontline workers as elected officials to protect our community. This is a sensitive space, and we will ensure that you are cared for.
Hello, can y'all hear me? Is it loud enough? Should I describe it?
I would love that, yes.
Hello, can y'all hear me? Hi everyone, my name is Jason Chavez. I have the honor and privilege of representing Ward 9 on the Minneapolis City Council. It's home to the Powderhorn Park neighborhoods, Corcoran, Central, East Phillips, Midtown Phillips, Longfellow, a little bit of Howe. And I'm very proud to be here with all these professionals and folks that help keep our country running. One thing that has been very clear is that the neighborhoods that I represent have been hit hard by Operation Metro Surge. And these are the neighborhoods where many of my community members are sheltering in place, who have been forced back into the shadows. And they're doing that because they're scared of our families continuing to be ripped apart. And they're scared that the ongoing occupation of ICE is going to disrupt not only our culture here in Minneapolis and the state, but our entire livelihood. Many of our community members can no longer shop. They can no longer go get groceries. They are struggling to pay rent. And one of the most damning thing of this all is that they're scared to go to the hospital to receive the medical attention that they deserve. And that's despite us knowing that we have the best medical professionals in the entire country here in the state. As a result of this occupation, my constituents, the people of Minneapolis and the state, have deferred their care for far too long. I've heard from moms in this city of them having to wait an extra day to bring their 15-month-old child to the emergency room despite having a fever. I've heard of moms in this city having to give birth at home. I've heard of moms calling their neighbors for help after their child slams their finger in the door, breaking their fingers, rather than doing what everyone should be able to do, and is come to the hospital. I've heard of too many cancer patients having to skip and cancel and reschedule their appointments months after, hoping that the occupation will then be over for them to be able to safe to go into the hospital. That is not an experience that anybody should ever have to go through. If you are sick, you should be able to go to the hospital because you deserve to get the medical attention that you need. And while the initial fear and intimidation that is being created by ICE and this occupation, we know that this crisis has only been reinforced by the inactions of healthcare institutions. which is why you're hearing clear demands that need to be implemented, not only here, but across our state. My constituents are struggling to trust these institutions to the point where they're scared to come here, and that's just not okay. That being said, though, I think we have to be very clear. The community here is here. That's why many of our neighbors have been observing, going to schools, going to grocery stores, going to hospitals, making sure that they alert our neighbors when ICE activity is in our neighborhoods. We have leaders here that are willing to stand up and fight for you. You have frontline doctors, nurses, and medical professionals that are here to protect you. And our entire community is going to have your back if you need to go to the hospital. Because we don't want you to delay your medical attention. So, as we continue to ask hospitals to make policy changes, and we're talking about real policy changes, we are encouraging you to go to the hospital, to go to your clinic, but to do so safely, to make sure that if you need a ride, that you catch a ride. Because what we can't let this occupation continue to do is only worsen the conditions of our neighbors. We don't want to have longer term impacts to your health. So, todas las personas tienen el derecho de ir al hospital, and what I'm going to say is that everybody has the right to go to the hospital. Entonces, vengan al hospital, vengan a las clínicas, come to the hospital, come to the clinics, because we have the best medical professionals that are going to take care of you, and that's just something we want to be very clear about. And if you can't go to the hospital because we know that there's still fear going on, please access healthcare in other means. Call your doctor, have telehealth visits, request rides from your trusted neighbors, because we know that we will bring you here safely. Have your neighbors pick up medication, and this is why I'm so proud of this city and this state. The amount of neighbors that are picking up medication for one another is just a very beautiful thing, and we're not going to stop doing that. And we're going to be very clear that it's going to take all of us. It is on our community, it is on frontline workers, it is on the state, it is on us, the city, as your elected officials, to take care of one another. So I just want to tell our neighbors that if you are scared to go to the hospital, just know that there are many of us here that are willing to take you and pick you up from your home, because we can't let the federal occupation continue to delay your medical attention that you need. So, thank you.
So, I've already heard from Representative and a couple other people that we do have to get them back into the hospitals and back into shifts. So we'll probably take time for 2 to 3 questions. If not, thank you so much for your time. Thank you.